Hello and namaste. I hope you're all well and keeping safe in this pandemic phase. COVID 19 has triggered more mental health problems all around the world in all sections of the society and all communities as well. This is also very true in the Indian context. Many people in India are severely affected because of the pandemic in terms of their mental health and mental health issues. Lockdown restrictions and the inability to travel to meet our friends and relatives when we feel like it, lack of employment, loss of jobs, loneliness and social isolation, and a whole load of other factors are actually causing stress and strain and anxiety and depression in this pandemic phase. Children and young people are also severely affected by these lockdown restrictions as they are unable to go out and play and socialize with friends and other people when they feel like. Their life and education has become more virtual and hence they experience a lot of stress and strain and anxiety as a result of all these restrictions. We are not alone in this. Millions of people around the world are actually engaged in this. Having mental health awareness or mental health literacy is the key at the moment in this pandemic phase when a lot of people experience mental health distress and mental illness. There is no health without mental health, and hence mental health literacy is the need of the hour. I am Raghu Raghavan, a professor of mental health. In this episode, I will explore the need for mental health literacy and how it is important in our lives for us to lead a full and happy life. India is one of the largest economies in this world, but at the same time, there is very little awareness of mental health or mental illness issues in the population in India. Nearly 1 in 7 people experience mental health problems at some time in their life in India. So what is mental health literacy? Mental health literacy is about the knowledge and understanding and awareness of how we create and maintain positive mental health. It is also about understanding the kind of treatments available, the kind of help and support that we can provide for the individual or a person with mental illness, and also the kind of support that is actually required for the family as well. It is also about having the knowledge and ability to recognize, manage, and prevent mental health problems. Because having mental health awareness or mental health literacy will help us to recognize the stress and strain, anxiety or depression, and possible ways of actually dealing with it, either by ourselves through self-help modes or seeking external help with a psychiatrist or a psychologist or any other mental health professional. Due to the stigma and negative attitude towards mental illness, many people suffer in silence and they do not actually seek help. We do not talk about mental health issues and they may not actually recognize the need of the person who is experiencing mental distress and may not be providing the right kind of help and support to that individual. Mental health literacy is not just for mental health professionals alone. It concerns all of us, and it is important for us to have that knowledge and ability to recognize mental health problems. If you're caring for somebody with mental illness, be it your husband or a wife or brother or sister or your mother or father, but having mental health literacy helps us to provide the right kind of help and support for those individuals, and to value and respect the person with mental illness. Ignoring them or running away from the problems or calling them names is not mental health literacy at all. It is stupidity, sheer ignorance, and criminal behavior. Generally speaking, we have very little understanding of mental health and mental illness. A person experiencing mental health difficulties with their thoughts or behavior or their feelings, this is not the time to ridicule them. This is the time to actually support them in the best way possible and provide love and care that would help them to talk more about it, to understand their needs, and also to try and seek what are the best ways of actually getting the right kind of treatment for that individual. Due to our lack of understanding of mental illness, some of the problems that actually happen in their lives is very poorly recognized, and often treatments are not given at the right time. In most cases, they are actually delayed, and sometimes we also go for the wrong kind of treatment, which is not actually helping the person in the long run. This will seriously affect the person with mental illness and also their family around them if we do not provide the right kind of help and support. Having mental health literacy also helps us to understand the stigma and negativity associated with mental illness. This is not rocket science. Anybody can learn and create mental health literacy. In my next episode on mental health literacy, I will explore how we can develop our understanding on specific disorders or different types of psychological distress or illness. Thank you for watching. Keep well, keep safe, and see you all soon.